All right. Good morning, everybody, and look, thank you for coming out on a Sunday. Today, I'll give an update on behalf of the Premier and of course, the Minister. Through my update, I'll then refer to Dr Kerry Chant, Minister Hazzard, and then Acting Commissioner Lanyon to give us an update about some of the enforcement in relation to masks. As of 8 p.m. last night, firstly, there were 18,923 tests in New South Wales, which I thank everybody for coming forward, but we do need to increase that number of testing. The success of this state has come off the back of the large number of testing that's been happening right across the state. And even though we are thankful for the 18,923 that came forward, we want to see those numbers get up, closer to 20,000, 30,000 people. And we are encouraging people, if you aren't feeling well, if you have any symptoms, please come forward, get tested, because if we're going to beat COVID, we're going to do this by getting those test numbers up. Out of the 18,923 tests last night, there were 11 cases. 3 acquired cases from overseas, and they are in hotel quarantine. The other 8 are locally acquired cases, and I'll break that down. 2 were connected, household contacts of the Avalon cluster. 5 are connected to the Berala cluster, and 1 is a household contact of a known source in Wollongong. So recapping, 8 locally acquired cases and 3 overseas. Can I also remind everybody today that a number of restrictions changed overnight as midnight last night, and that is to do with more importantly about venues, weddings, funerals, church services, the number of people in gyms, and all that is available on the website. But most importantly, the message today is about masks. As of midnight tonight, we will, as of tomorrow, be enforcing the mandatory wearing of masks in indoor venues, and again, those venues are on the website. But they're venues like, of course, gaming rooms, hair salons, nail salons, retail, and we're asking people just to do the right thing and use common sense. Where practical, where possible, please wear a mask, and you're going to help us deal with the issue in relation to the transmission of COVID, especially on public transport. What I'll do now is ask Dr Kerry Chant to give you a more detailed brief on the cases, and there's some good news in that, and I'll ask Dr Kerry Chant to say a few words.
Thank you, Acting Premier. So New South Wales recorded 8 new locally acquired cases of COVID in the 24 hours to 8 p.m. last night. 5 of these cases are linked to the Berala cluster, which now numbers 13, and 2 of today's cases are previously reported cases linked to the Avalon cluster, which now numbers 148. And 1 case is a contact of a previously reported case from Wollongong. 5 of today's locally acquired cases are from Western and Southwestern Sydney and are linked to the Berala cluster, and there are now 13 cases in the Berala cluster. So in response to the Berala cluster, New South Wales Health has revised our advice for the Berala venue of concern, the BWS at Woodburn Road. So anyone, this is critical information because we know that there have been transmission events at this venue, and it is important that we know that also those transmission events occurred through what appear to be very brief exposures at that venue. So this advice is for people who attended during these times, irrespective if they think it was just a fleeting visit to this premises. We want to act in a very precautionary way, and we are asking for your assistance. So anyone who attended the BWS Berala on Woodburn Road between Tuesday the 22nd of December and Thursday the 31st of December for any amount of time during the times I'm going to read out is considered a close contact. Must get tested immediately, self-isolate, remain in isolation for 14 days since you were last there, regardless if you receive a negative test. The times are Tuesday the 22nd of December from 12:41 to 9:15 p.m. Wednesday the 23rd of December from 1:40 to 9:15 p.m. Thursday the 22nd of December from 12:40 to 9:17 p.m. Saturday the 26th of December from 9:55 a.m. to 7:15 p.m. Sunday the 27th of December from 12:39 p.m. to 8:15 p.m. Monday the 28th of December from 9:30 a.m. to 7:15 p.m. Tuesday the 29th of December from 1:41 p.m. to 9:15 p.m. and Wednesday the 30th December from 12:45 to 9:15 p.m. and Thursday the 31st of December from 8:30 a.m. to 3 p.m. We have identified more than 2,000 people have been contacted and told to get tested and isolate in relation to the BWS store, and New South Wales is also reviewing the CCTV footage in an effort to understand how the transmission events occurred. We are also I'd like to acknowledge the cooperation of the BWS in assisting us with contacting people who either used rewards cards or other means of paying on that day so that we can reach out to you. But please double check. I mean, I know it was a busy period, but we are very concerned that transmission has occurred at this site. And it is important because the duration of time means that someone who has previously been there could have actually transmitted it to another group of people. So again, that's our message, is if you live in that broad area around Berala, that whole Cumberland local government area, we're asking you to please have a low threshold for coming forward and getting tested. So the most minimal of COVID symptoms, please come forward and get a test. We will be attempting to contact you, but our records might be incomplete in terms of who was at that premise. So please reach out to your friends and family who you know use that bottle shop and check with them, and the updated details will be on the New South Wales Government website. In new information that has just emerged prior to this press conference, the genomic sequencing results have come back. And what they show is that the Berala cluster is actually the same genomic sequences as linked to our patient transport driver, not the Avalon. So just to recap, we have been dealing with two different strains that have been causing clusters. We had a person who had returned, a family group who had returned from overseas and were transported to a health facility. Unfortunately, one of the patient transport workers acquired infection, passed it on to a colleague. That colleague had been at the Berala BWS for a very fleeting amount of time, but what we now know is that transmission occurred. So it is critical that, because we know these transmission events have happened through very minimal exposure, we are asking members of the community who did purchase alcohol or enter that premises for that period to be very vigilant and take the public health action of isolating for 14 days if you were there at those times. This assists us greatly because it means that we have a clear line of the transmission, and it really does mean that we have less missing links. We are still concerned about a case that occurred yesterday where we still haven't managed to find links in terms of the Avalon cluster, and there are still, despite intensive investigations, inability to link the Wollongong. While we know genomically the Wollongong, Croydon and the Avalon clusters are linked genomically, we still haven't found that missing link there. So our investigations continue, and thank you very much for your cooperation.
Thanks very much, Kerry. Good morning. I'd like to start off by thanking particularly the Western, or the community of the West and Southwest. Clearly we have some major concerns in relation to the number of people who may have been exposed in the area around Berala. So we're asking people from that area particularly to come forward and get tested. As the Acting Premier said, just over 18,000 people being tested is not what we would hope for. We're hoping for far, far more. We've seen what Sydney can do, and Sydney can rise to the occasion. We're asking all of the community in Western and Southwestern Sydney, and indeed in Wollongong, to rise to the occasion again and go out and get tested. Getting tested on one occasion is not the end of it. It may well be that in the days subsequent to that test you are asked by health, because you visited a particular facility, to get tested. Please do it. If you have any symptoms in the subsequent days, go and get tested. We need you to get tested. We also want to emphasise, I want to emphasise the fact that masks, as of midnight tonight, will be compulsory. Now, obviously, people have known for a long, long while that it was likely that at some point we may give that direction. I think from what I've seen around the community, many people are already wearing masks, and I want to thank them for that. Certainly in my local shopping centre, I would say that about 98% of people are already wearing masks. I would encourage the community across Greater Sydney, and that includes the Central Coast and the Pea and Blue Mountains, and of course Wollongong, to wear masks in compliance with the law. But do it for yourself, do it for your family, do it for your community. That's the main reason, because in wearing a mask, you will be keeping yourself, but also your locals, your family, your community, and of course, possibly eventually the whole of New South Wales safe. I want to emphasise too, because there seems to be some lack of certainty about the precise areas, I want to emphasise that masks should also be worn in other areas that were not mentioned yesterday, but include bank branches, post offices, hairdressing salons, beauty salons, tanning salons, waxing salons, spas, tattoo parlours, massage parlours, betting agencies and gaming lounges. Make sure you wear a mask. And of course, it's very clear to everybody, I think, that you need to wear it on public transport, but please don't play games with yourself or with the community. Wear them when you're getting to the transport facility. If you're out in the queue, put the mask on. The critical issue that we have talked about now for 11 and a half months is the 1.5 metre social distancing, getting tested if you have any flu or cold-like symptoms, and of course hand hygiene. But those are, at the end of the day, the most important issues, backed in by wearing masks. So please wear the masks. I know that there's been some public discussions about whether or not everybody will be fine tomorrow. Can I say this, that I think that everybody should be wearing a mask tomorrow, save and except for those people who clearly have reasons not to. So if you have, for example, emphysema or a lung condition or another health issue, if you have disability, for example, I know there was discussion yesterday about people who have autism and sensory issues. Clearly those issues will be ones that under the orders are allowing you not to wear a mask if you don't need to, but if you can, still wear a mask because it's safer for you. Don't just rely on that if you can still wear a mask. I certainly have spoken as Health Minister to the Acting Police Commissioner and asked him to convey to our police to exercise discretion tomorrow and in the next few days. The discretion, though, will be obviously carefully applied. If you don't have a good excuse, well, you'll be fined. We understand that there are people who, for example, may have been ill at home and have not been out yet to buy a mask, and they're on their way to, for example, a pharmacy or a shop to buy a mask. Those are issues which our very good New South Wales police members will take into account in the next few days. But at the end of the day, it isn't a time for avoiding masks, it is now a time for wearing masks. Please ensure you do. Thank you.
Dr. Chan,
Sorry.
Oh, sorry.
The Acting Commissioner would like to have some words first. Thank you. Mal Langdon.
Thank you, Minister. Good morning, ladies and gentlemen. As both the Acting Premier and Health Minister have announced, new health orders came into effect from 12 midnight this morning. Importantly, within those health orders are the mandating of the wearing of masks in a number of indoor settings. The indoor settings are outlined on the health website, and the Health Minister has been through a number of those. Those offences will come into effect from midnight tonight, which means that police are able to enforce the health orders from midnight tonight in terms of the wearing of masks. Can I make it very clear that in the initial aspect of this health order, we will be focusing on compliance. New South Wales Police will work very closely with the community to ensure that they understand the nature of the orders and that they comply. We want the community to work with us and wear masks in those indoor settings. It's incredibly important and incredibly vital to stop the spread of the virus, but also to keep the community safe. The community have by and large responded magnificently to the public health orders that have been in place so far. We have been greatly appreciative of the way the community have worked with us, and to be honest, we haven't had to enforce a significant number of offences because of the way the community have worked with us. There is a $200 fine for an individual who fails to comply with the health order in terms of the wearing of a mask from midnight tonight. However, that will be a last resort. We will use a very common sense approach to our policing and discretion where it's appropriate. As I've said earlier, the key focus for now is ensuring compliance. As the Minister said, there have been significant numbers of people wearing masks in those indoor settings. This is really an extension of that. It is nothing new, except that it gives us a greater opportunity to stop the spread. Can I ask that you work closely with the police, ensure that you comply, and can I also ask that you show some compassion for other workers that are in these particular industries that are now subject to the health order? I have no doubt that some members of the community will be asked to put a mask on when they're either on transport or in a store. Can I ask that you do that and don't take offence? It's the only way that we are going to get on top of this virus is to comply. Thank you.
Sorry to not be understood. Now, Dr. Kerry-Chan, we confirmed that the lease we are looking at BWS Berala is one worker having transmitted it to another worker. Now, in the space of those 9 trading days, consecutive days for so many hours, you must have some idea how many hundreds of customers have been served by those 2 individuals. Can you give us that number, please?
So look, we're not confirming the details of who's acquired the infection there or who's spread it. What we've indicated is that there is a number of cases associated with the cluster. I think it's very important that we protect the privacy of the individuals involved. But what we know is that there was transmission and we've identified the risk periods. We know that there were many, I think there was an estimate of about 1,000 customers that were served on New Year's Eve. Christmas Eve. That gives you an idea of the volume of people that, and that may have been a peak trading time. But I would want to express my appreciation for the company involved. We are working incredibly closely with them. They've been assisting us with any information we can have to reach directly out to people who have attended that premise, but we are urging the community to assist us as well.
Given the fact you've got 1,000 people on just a particularly peak trading day, did you say 1,000, sorry?
We said that I've been advised of about 1,000.
Yeah, 1,000, okay. So that 1,000 day, you can extrapolate that even with smaller trading days, it will be certainly in the thousands over the course of 9 days. Is it at the point now where it's worth asking secondary close contacts to isolate as a precaution?
So what we're doing is asking anyone who's got symptoms to come forward for testing and isolate while they're waiting for a test result. So at the moment, we've reached out to 2,000 people have been contacted, and we will continue to contact more as lists become available and any new information. What we would generally say is if you're been at the Berala and you've got symptoms, then the rest of your household should actually stay put. If any of them have got symptoms, they should get a test, and they should really stay put until you've got cleared from that in terms of negative. Because what happens is if you are a positive case, your whole household will be required to be in isolation for that 14 days.
Well, how does this cluster rank compared to previous ones, the Crossroads one, Casula, given the fact that since you've been able to confirm that source, many thousands have been potentially in contact? I mean, where does this rank? This sounds particularly precarious.
Look, we have managed situations where we've had large numbers of venue contacts. We've had, I think, through the Avalon and the Avalon Bolo, we've had many of the venues that you've probably seen on our website, the vast number of venues that we've had. So we've been having, upwards of 5,000, 6,000 people that have been contact traced at any one time. So this is obviously concerning. What's concerning is about the brevity of the exposure that's led to the transmission. And that's why we're trying to convey that message of the fact that we have got elevated risk. But our key is to find every single last case. And it is pleasing that people have come forward for testing. So the way we've been able to further find this linkage, we had this as a possibility. It's been confirmed by the genomics. But we have made those links in those people. So thank you very much to those individuals who came forward for testing.
The difference is, and sorry guys, just
Yep.
one more follow-up question. With Avalon, there are many people in a large, albeit confined space indoors, where individuals may have had no contact or gone nowhere near a person who might have been infected. I understand for privacy reasons you can't confirm this, but with an employee there serving people, literally every single person who's gone there has had some degree of close contact with somebody who is getting them to tap on their phone, is providing a bag, is packaging up their items. That's a bit different, isn't it?
So what we're looking at is how the transmission may have occurred, and that's why we appreciate the cooperation in providing the CCTV footage, because that gives us an idea. There are a lot of places have put in barriers, and I understand there's perspex screens, there's other controls. We need to work through that methodically. I think the key focus we've got today is alerting and asking for the cooperation of anyone who had been there. We will be attempting to reach whoever we can through whatever records we have, but this is critical, and I can't stress enough how concerned we are about the transmission potential. But hopefully the message we've been giving on a number of days, we've been clearly concerned about BWS and Berala, and I think I've been mentioning it in previous press conferences for a number of days. And I would expect that a number of people in that vicinity or have gone there have got tested. We're asking them to do the next piece of hard work, which is remain in isolation for that 14 days, and if symptoms recur, get a test again.
You mentioned that this is actually being linked to the patient transport driver as opposed to the Avalon cluster.
Well, I'd prefer to say it's linked back to the overseas travellers that they conveyed through a few different twists and turns, but yes.
Can you just elaborate a little bit more on how you've been able to track down and obviously we know the genomic sequencing, but how has that link happened?
I think it's just about what we do. So any time we have a case, we look for who are the close contacts of that case. We then map out where they've been. We also look at what's called, in some situations, upstream. So the purpose of upstream is where people might be in exposure. But in this case, we have identified possible sources when a person gets diagnosed. Obviously, transporting sick patients that actually had COVID is a plausible path. But we did keep an open mind to other exposures because we did have the Avalon cluster at the sort of same time. We then do close contacts, test around it, as we indicate they're the most likely to be positive, and then interview each case methodically at where they've been and find crossover points.
But at some point, someone from that overseas return traveller cluster has then come in contact with someone.
That's correct.
How is that?
So an infected person associated with the overseas transport attended the Berala BWS on the 20th of December. And we think that is the exposure, and then that has then triggered infections, which has then led to this cluster developing. That is our current best available information.
What about the Northern Beaches cluster? I know we keep revisiting this. Is there any idea, do we know any more about patient zero now a few weeks down the track?
No, we don't know the patient zero, the person who introduced it into the Avalon RSL. It is actually challenging because people's recall of when symptoms were onset. Can I just express my appreciation? A number of people have given us blood and other tests to try and help us clarify that, but we haven't actually found definitively. We've obviously looked at those cases that had the earliest symptom onset and gone back, but at this moment we can't clarify. And to be perfectly frank, at this point, whilst that's useful for then finding that further link to Belrose or connecting it back to a source, at this point in time, you know, we may never find that exact link back.
Dr. Chan, I tend to have a one-track mind here, but just getting back to that same issue, secondary close contacts and nothing that have been really considered by New South Wales Health as
so no. So in terms of secondary close contacts, we do ask secondary close contacts to isolate, and what we're asking them to do is, if you're in this situation, for the secondary close contacts to isolate until the person has got a negative test. Once that person has a negative test, then what we're looking for is effective separation. So you should be immediately self-separating, but the priority at the moment is really getting the tests on people who are directly exposed, and obviously anyone else with symptoms. That will help us track down and suppress this transmission.
So, I mean, this is very rubbery maths here, and I'm a journalist, so you'll forgive me, but we're talking about several thousand people who are now considered close contacts, each of those several thousand people may well have 3 or 4 other people in that period who are considered close contacts. Is it now New South Wales Health's suggestion that some 20,000 people isolate until those initial close contacts are tested and get their results?
So we will give the advice relevant to it, and as I said, I've been very clear. Anyone who's been at those venues, if you've got symptoms and you're going for a COVID test, ask your friends and family to just stay put until you get a clear test result. That is the safest option. Don't go into any aged care facilities. We have taken action to prevent visitors currently in relation to aged care facilities. But what we always want to do is stop the further spread. But the best thing you can do is, it's a broader message. It's not just the contacts of contacts at a risk, because the symptoms can be so mild, someone may not have realised they've got COVID and passed it on to others. So we're just asking everyone to come forward for testing. It's pleasing that the testing numbers from this morning seem to be elevated, but can I challenge us to really get that high score? Can we please just, everyone in that community, respond? I know you can do it. We've set up a number of testing clinics, and I would just ask that you go forward and just act in a very precautionary way. This will give us the best intelligence of what the scope of this spread is.
So just to clarify, and I don't want to oversell it, but I don't want to get it wrong when I'm reporting it. That is effectively tens of thousands of people that you are asking to isolate. Those first initial close contacts to get their results. Is that correct?
That's correct. We're asking people to act prudently. Can I just say also that there's been a bit of time from some of those earlier dates, and I'm really heartened to the fact that we've found people that have come forward for testing in those intervening times that have linked. So many people in the community will have already taken that action of coming forward for testing, and for you, thank you. So it's really hard to actually calculate the impact here, because many people may well have already ascertained their status and be taking the appropriate action. But we've got an amazing community in New South Wales, and we are asking you to go the extra mile, particularly associated with this, as we aim to achieve no community transmission as soon as we can possibly do so.
Just on masks, obviously the ministers have made their plea. Why is it so critical at this point, in this juncture, to wear a mask?
I think we know that we've really focused on indoor settings. And we've focused very much on indoor settings where you might have different social groups and networks that you don't normally go with. So when you go to a restaurant and hospitality, you're generally going in a group, and we know who that is. In terms of supermarkets, retail and other settings, you're potentially crossing paths, albeit for shorter duration of period, with people that you may not have in your social networks. So masks help us control the spread, and particularly the settings we've chosen are those where you're interacting with people from different social networks.
Question for Mr Hazard and for Mr Berala too. For New South Wales to work, you effectively would rely on Victoria to work successfully and Queensland to work successfully in open borders. There are reports emerging from Victoria of, frankly, a dog's breakfast of organisation there of people not being able to get tested and being bumped to their suburb where there's a 24-hour shutout before they can get tested. Do they really need to work on, I don't want to get this is not a state warfare sort of thing, but
I won't be. I've made that clear in the past, Robert. Look, all I'd say is this, that I talk regularly. In fact, there's been communications already this morning with the Victorian Minister, and obviously Victoria is doing its best. I think it's best if we as a state support Victoria. In our recent times, we have sent nurses down there to the front line. We've sent public health officials. We've had their team come up here to look at some of our tracing. So I think New South Wales will take a supportive and we will address whatever Victoria asks us to do. But we won't be passing any negative comments, because that's not productive.
Well, I'm not just seeking criticism, but I mean just...
I think you might be.
Victorians to have some semblance on how their system is working. Do they need hundreds and hundreds of more people to make their system more effective?
As I said, our government is focused on New South Wales and working collaboratively with other states and territories. That has always been our approach. New South Wales has always tried to keep our borders open to make sure that we can have jobs, an economy that works well, and of course that supports mental health. And we will continue to do that. And I, for one, and I don't think any other member of the government here will be passing negative comments about Victoria.
Is there anything we can do to help the Victorians that are stranded on the side of the
Look, we're looking at all those options at the moment and trying to work through it with the Victorian Government, but at this point there's no clarity on that at this stage.
When it comes to masks, obviously people will be doing their best to adhere to the new rules that have come in. Does the government plan to issue free masks at any sort of intensely populated spots across the city, such as train stations?
Transport New South Wales has been handing out masks in hotspot areas, and we'll continue to do that. And of course, we've also offered to Family and Community Services to ensure that there are masks available for vulnerable families who may not have been able to afford them. We'll take a number of sensible measures, common sense measures, to support our community. But I also want to thank a lot of the retailers who have made masks available to people when they've just forgotten them, when they've arrived, even in the last few months. I would encourage our retailers and others to partner with the government in this. It's a community-wide effort, and I think common sense has worked well so far, and I expect it will continue to work well.
Dr. Chan, can I just clarify? Yesterday we had an unlinked case in that inner southwest area. Have we got any more news on whether that's been linked to a main cluster?
There is one case, it's a recent case, and that there is one case outstanding that we haven't linked. The investigations yesterday were able to link one of the other unlinked cases because that person had also attended the BWS. So there is one unlinked case that's occurred in recent days. I'll just have to clarify whether it was yesterday's or the previous 24 hours.
Sure. And just to confirm, so the 5 new cases out of Berala today were all customers at that BWS?
I think we're not discriminating between staff, and but we indicated that there were a number of that 5 are linked to the Berala cluster, some household contacts and some people that are from the direct household contacts of previous cases linked to the Berala, and then 2 cases, a person in his 40s and another case in his young man who attended BWS as well.
Dr. Chan, can I ask you about the specific strain? So from international travel to a transport worker who was then gone December 20 to Berala BWS, is there an additional concern that that specific strain was brought here by a British traveller or the South African strain, which are more virulent?
So I understand that that doesn't have any particular variants that we're concerned about increased transmissibility, but we'll ask our genomics experts to review that strain and provide advice.
Mr. Berala, there is the suggestion that Sydney might have to shoulder a second cricket test with the Indian players unwilling to go through quarantine measures in Queensland. Do you welcome that? Are you prepared for that? What's your reaction?
Well, firstly, we're putting on a test, and Health is working with the SCG and Cricket Australia and organisers to make sure that when the next test is played in Sydney, it's done in a safe way, that we protect those patrons, we protect the community. But we have already proven in this state that we can hold large events like the NRL Grand Final and State of Origin, and we haven't had that issue of a transmission. So we'll continue to work. There are some concerns about the SCG and the upcoming test that Health is working with those organisers. But yesterday, having people in particular zones, we've got to deal with some issues around of course, wet weather, if that was to apply over the few days. The other thing we are concerned about is because of the Berala cluster. If you're coming from that area, the broader Cumberland area in real terms, we're almost encouraging you to rethink about going to the test, and maybe there'll be more said by Health and the government over the next day or so in relation to that. So if we're going to put on an alternate test after that because of what's happened with the breaches, well, that's up to the Queensland Government. First and foremost, that bubble is to protect the players and community. And here in New South Wales, we can host the test. Now, if those breaches have impacted the conditions that the Queensland Government have applied to the Indian cricket team or to the or both cricket teams, well, that is something for the Queensland Government to make a decision about.
It's kind of impossible to answer that question given the fact we're talking about a test in a few days and then another test. You don't know what the numbers are going to be like in 10 days, 12 days' time. Is it just too difficult to give an answer on whether you could commit to a second SCG test? We're committing to the test that we know that we have, and we're going to do that in the most safest possible way and protect everybody in this state. That is our priority. If an opportunity arises post that, we'll deal with it when it arrives. Thank you very much.
Thank you. Thanks very much.